So our next speaker is Dr. Alpa Kumar. I think I already actually introduced her, but I'm going to say it anyway, just in case you have just joined us now. She's a portfolio GP, a lifestyle medicine specialist, a health coach, and she has a special interest in sexual health. And she's going to talk about rheumatoid arthritis. So, Alpa, are you here? I hope you are. Oh yes, there she is.
Hello, good afternoon, everyone. Hi. Thank you for having me here.
You're welcome. We are really lucky to have you here. So I think you have a presentation prepared for us, don't you? Yeah.
Yes, I do indeed. I'm going to
mute myself and you go ahead.
Yeah. Okay, there we go. Hello? Yes, can you see my screen now?
Yes, I can see it.
Okay, wonderful.
That's fine. Keep it like that.
Okay, great. Hello, good afternoon again, everyone. It's a pleasure and an honor to be here to be presenting this on behalf of Plant-Based Health Professionals UK. And the topic for my talk today is, can a plant-based diet and exercise reverse the symptoms of rheumatoid arthritis? Let's find out. So going back to the basics, what is rheumatoid arthritis? You know, rheumatoid arthritis is an autoimmune disease. This basically means that your immune system, which usually fights infection, it starts attacking the cells that line your joints by mistake. So what does that lead to? That leads to the joints being swollen, stiff, and painful. So let's look at the normal joint for a minute here. That's your bone. The cartilage, which is the stretchy, elastic-like connective tissue between the bones, and then you've got ligaments which connect the bone to the cartilage, and then there's the synovial membrane, the fibrous sheet protecting it. And look at this picture of the joint in rheumatoid arthritis. So here there's bone loss, the cartilage is eroded, the synovial membrane is thick. So in a sense, the joint doesn't look remotely like what it should normally. But I must warn you, this is not like the beginning of rheumatoid arthritis. We're looking at kind of end stage here, the picture. But that's the physiology behind what's happening in the joint. The cells, your body cells are attacking your own body cells. So the joints are mainly affected, and you classically see that the patient is complaining of morning stiffness, which lasts usually more than half an hour in the morning. And they might also have other symptoms which might be related to organs like liver, heart, eyes. So it can be multisystemic. And often rheumatoid arthritis is also associated with other autoimmune conditions. Now, in the UK and worldwide, I'd say about 1% of the population suffers from rheumatoid arthritis, which is roughly about 400,000 people in the UK are diagnosed with rheumatoid arthritis already. And the incidence is rising. So what are the risk factors for rheumatoid arthritis? We talk about genes. Again, I must emphasize the genes are not your destiny, because according to studies, only 1 out of 3 people who carry the genes for rheumatoid arthritis end up having it. So what are the other factors? So it can be your environment, the hormones working inside you, especially estrogen is related to rheumatoid arthritis. So we often find that women suffer more with rheumatoid arthritis than men. And, the role of estrogen. And again, estrogen is raised in obesity as well, which explains, why there's an increased risk of having rheumatoid arthritis if you're obese. And again, one of the other known factors for rheumatoid arthritis is smoking. So that was kind of a brief outline of what rheumatoid arthritis is, without going into too much detail. Let's talk about nutrition, because that's the core of what we are discussing today. Now, this was a very good systemic review of the current knowledge of the effects of nutrition, diet, on the outcomes in rheumatoid arthritis. So when we talk about outcomes, we're looking at pain, disability, fatigue, your day-to-day life. So this systemic review actually has made life much easier for us, as lifestyle medicine physicians and as doctors, because it just gives us an overview of 70 human studies that have been done on the role of diet and nutrition. So the essence of the study, what the conclusion was, that it is time to talk about nutrition. Right, so what have we learned from these studies? 4 key takeaway points from the 70 studies that the systemic review lays emphasis on. Point number 1, fiber. Now, what is the fuss about fiber? Fiber is the key component of diet which reduces joint inflammation here. We know from previous studies and knowledge that, fiber forms the bulk of the diets. Are available only from plants, and animal protein doesn't have any fiber. So fiber has a huge anti-inflammatory role, which might be implicated in reducing the incidence of autoimmune disease and also in preventing progression. Fiber also has an important role in decreasing weight, which again, as we learned before, obesity can be a factor in producing more estrogen in the body, which again is related with inflammation. So fiber is the key. The second thing that came out of these studies was omega-3 fatty acids. So omega-3 fatty acids, as we've heard in the previous talk as well, they play a huge role in our brain health, the cardiovascular health, which is the heart health, and they reduce the symptoms of joint pain in rheumatoid arthritis. Thirdly, a plant-based diet, especially there have been numerous studies about vegan diet, which helps to, which is central, which is key to reducing flare-ups and achieving a remission of symptoms. In one study out of these we're talking about, just a 3-week vegan lifestyle resulted in a 33% reduction in the inflammation marker levels. So this is really interesting. This is what we could quote to when we go for a visit to a rheumatologist and say, what do you think about this? This is the study that's come that a third of my symptoms can be reduced, the inflammation markers can go down. And, this is something we could talk to general practitioners and also to family members, friends who suffer with autoimmune disease or who have a family history of autoimmune disease. So key things there to take away from that systemic review. And fourthly, vitamin D. We've all heard in the last year in the pandemic how important vitamin D is, in preventing severity of COVID. And no wonder, it has been researched all this year, it also prevents the severity of autoimmune disease. In fact, one study even mentioned that vitamin D can be the key in preventing the trigger that causes the cascade of autoimmune disease to happen in the first place. So 4 key points from those studies: increase fiber in your diet, incorporate omega-3 fatty acids, a plant-based diet, preferably a vegan diet, and vitamin D. Moving on from that study, there's another key study, which is the core study related to what I'm talking about today. So this was a review which was published in 2019 about nutrition interventions in rheumatoid arthritis. So it basically, the key takeaway point from this is exclude animal products in your diet. So, easy, isn't it? That is the takeaway point. Exclude animal products from your diet. Increase fiber in your diet. So that reinforces what that systemic review had told us already. So again, when you're having a conversation with your rheumatologist or with your friends and family, take away these points, discuss about the potential role of animal protein in the inflammation in your gut, in the inflammation in your joints. So that is the key. That's why animal protein is not good for autoimmune disease, in the sense that it aggravates the inflammation. And we know that inflammation is a huge trigger for autoimmune disease. So inflammation can be prevented by moving away from an animal protein-based diet to a plant-based diet, rich in diverse fruit and vegetables, rich in omega-3 fatty acids, and rich in vitamin D. Now, we talk about, rheumatoid arthritis, but we know it's a part of the autoimmune disease spectrum. We often find that in clinical practice, and having spoken to many patients with autoimmune disease, that they are diagnosed with one disease, and then, a couple of years later, there's another, label put onto them. So say they started with the rheumatoid arthritis, then they've got IBS. So, and the incidence is increasing day by day of what we hear about it. So the link between diet and autoimmune disease has been studied extensively. So to quote a few studies, which are, quite large studies and have advised plant-based diet and vegan diets. So the first one is a 2013 study by Tonstad, which uses the data from Adventist Health Study, which had nearly 66,000 people enrolled in it. So it showed us that it lowers the incidence and prevalence of autoimmune hypo and hyperthyroid disease with people who were following vegan diets. So, and again, they found out that the inflammatory properties of animal products were the ones that were triggering off this autoimmune disease. So to go to second study, there are numerous, but these are the big ones, as I said. Laura et al. Used the 1993 case control study. This was really interesting. It had about 11,000 people in it, and multiple sclerosis, positive association with meat and dairy, inverse association with fruit and vegetables. So this is the evidence we need to talk to people, to family, to our health professionals, that look at these studies, they're there. We need to incorporate more fruit and vegetables. We need to reduce the inflammation in our body. We need to move forward to an inclusive whole food plant-based diet. Now, coming to the NICE guidelines for rheumatoid arthritis. NICE is the body, the National Institute of Clinical Excellence in the UK, which sets the gold standards for doctors to diagnose and treat disease. So what does it say about rheumatoid arthritis? It says, use medication 1 for joint pains and symptoms. If medication 1 is not working, use medication 2. If that is not working, use medication 3. And the endpoint is surgery when there is complete, total joint destruction. So yes, that is the protocol doctors are supposed to follow. But may I add, based on all the evidence we've just seen, that we incorporate plant-based whole food diet, which would help us not progress from the stage of medication 1 to surgery. This is a very good plate of food, which is from the American College of Lifestyle Medicine. It recommends this whole food plant-based plate for treating and reversing chronic disease. When we talk about chronic disease in lifestyle medicine, we generally talk about cardiovascular disease, diabetes, and type 2 diabetes, or some cancers like colon and breast cancer, so and high blood pressure. But I think autoimmune diseases should be a part of that spectrum as well, because as we've seen, the evidence for whole food plant-based plate is compelling. So what does this plate tell us? It says fruit and vegetables, half of your plate. So the recommendation from NHS UK is 5 portions of fruit and vegetables a day. And I personally, in my practice, and which most of the NHS doctors are doing as well, is recommending 7 to 10. This is where the NHS guidelines are heading to as well, is 7 to 10 portions of fruit and vegetables, eating a rainbow diet, which incorporates various colors of food to increase the nutrition value in your diet. So a quarter of the plate. Now, before I come to the plant proteins, let's tell you, this is the question I get asked a lot in my clinical practice, is where do you get proteins from if you're going on a plant-based diet. So there are great leaflets on the Plant-Based Health Professional UK diets, which you can print and give to patients, and also use to give it to your friends and family who are thinking of going on a plant-based diet or who are struggling to find out more about plant-based diets. So my take on plant proteins, when I try to explain this concept to my patients or friends and family, is that compare chickpea and chicken, and there is not an awful amount of difference in the amount of protein. I think for about 100 grams of chicken, it's 22 grams, and chickpeas 19. I would say that is not an awful lot of difference. And combined with it, the nutrition value chickpeas bring with the fiber. As we learned, fiber is anti-inflammatory. So, and animal protein don't have fiber. So there we go, all the nutrition like, micronutrients like iron. So plant protein is actually a powerhouse. It's packed with other nutrients as well. And coming to the other quarter of the plate is whole grains, which would be, brown rice, brown bread, quinoa, and the like. And add herbs and spices, drink plenty of water, at least 6 to 8 glasses of water in a day. So that is a very good visual to have a look at what plant-based, whole food plant-based plate looks like. And may I thoroughly recommend this Plant-Based Eat Well guide. This is from Plant-Based Health Professionals UK. And what is the 4 key differences from the American College of Lifestyle Medicine guide that we've just seen? The key difference here is, if you look at this portion, this is about plant-based milks. So plant-based milks are generally fortified with vitamin D. We learned how important vitamin D is in preventing inflammation and stopping progression of autoimmune disease. So, and they are also, fortified with vitamin B12. So coming to the second key difference is this recommendation for vitamin B12, because if you are on a vegetarian or vegan diet, you need vitamin B12. Having said that, even meat eaters later in life, they do need vitamin B12 because they can't absorb it as well as they could before. The third key difference here is the fermented food. So we were talking in the last talk, we were talking about the gut microbiome, how important, the gut is for your health. There is increasing research. Why? Because 70% of your immunity resides in the gut. There are various hypotheses, various studies which show that, gut is the key. Sometimes, in some studies have even said that autoimmune diseases are triggered by, unhealthy choices, bad gut. And that's not surprising, because by eating a diet which is not rich in plants and which is not, rich in whole food, you are changing the microbiome of your gut, which is responsible for, the immunity in your gut, which is responsible for fighting all the infections and the inflammation away. So these fermented foods here, they help you in maintaining a good gut flora. So also we talk about unhealthy products, which is, fourthly here, what you shouldn't eat. I think most of us know what we shouldn't eat. So I think when we are starting on our health journey, it should be about crowding out. And at the British Society of Lifestyle Medicine, we talk about one change, which is, slowly transitioning into a plant-based lifestyle. If you've grown up, eating animal-based food, obviously, thought of going on a vegan diet or even on a vegetarian diet, it seems quite overwhelming. So where do you start? Start with one change. And what I usually recommend is that change be adding something which is healthy in your diet. Say, add a bit of kimchi in your diet, or add 1 tablespoon of flaxseed in your diet. So, go step by step, because anybody who's not, say, for example, if you compare it to exercise, hasn't walked in years, and we say, okay, right, you're now going to do a sprint and we're going to time you, that approach doesn't work. So yeah, one small change at a time. Take it easy, keep this stuck to your fridge wall, and that would help you to, incorporate more fruit and vegetables, eat whole grains and omega-3 and plant-based milk. So why do we recommend whole food plant-based? We've learned about the evidence for vegan diets, for vegetarian diets, or plant-based diet. Now, when we talk about diets, we also think about sustainability. Is this something sustainable? I mean, how many of us have started on a diet on the 1st of January and by the 15th of January, we are struggling? That is common. That's testing your willpower. That's not what food should be about. Food, in my opinion, should be about nutrition, about nourishing yourself. So something that's sustainable, and whole food plant-based diet, in long-term studies and in personal experience, they are sustainable. They are evidence-based. We've learned evidence about it. Now, a 2019 Eat Lancet Commission, they were experts from 16 countries who sat down and analyzed several hundreds of thousands of studies on nutrition and health. And guess what the winner was? Whole food plant-based diet. So, in that planetary health plate, every country's got their own health plate. We saw the American one, we saw the fantastic Eat Well guide, and the planetary health plate, they recommended the eggs, dairy, and poultry are considered optional, but we know that they are inflammatory, so it's best to avoid them. The new 2019 American guidelines for prevention of cardiovascular disease, which again, I think it's double the risk of having a cardiovascular disease with rheumatoid arthritis, which is why lifestyle factors, including nutrition and exercise, play a key role in preventing cardiovascular disease. And that's why they're important in rheumatoid arthritis as well. So those guidelines specifically mention whole food plant-based diet as being helpful. Now, quick visual about omega-3 fatty acids. So flax seeds, algae, seaweed, a handful of walnuts, hemp seeds, chia seeds, they're all excellent sources of, spirulina, omega-3, DHA, EPA, they're excellent sources of omega-3 fatty acids. So there is a common opinion that you need to eat fish to get your omega-3 fatty acids. As we can see, we've got a variety of sources. The easiest way I find is that in my morning bowl of porridge, I add 1 tablespoon of flax seeds, ground flax seeds, and that's done. That's my cardiovascular risk prevention done. So let's ponder over this after learning about the role of food and rheumatoid arthritis. Let your food be your medicine. I know you've heard that before, but reinforcing that, what we've learned today, plant-based diet is the key to prevent inflammation in your body. It's to prevent, as we know from previous study and experiences, prevent obesity, help in weight control, prevent cardiovascular disease, which again has a strong link with rheumatoid arthritis, doubling the chance of you having cardiovascular disease, and certain cancers as well. So and other autoimmune disease like multiple sclerosis, chronic fatigue syndrome. There is increasing evidence and increasing research about plant-based diet. So vital information for you to share with your friends and family is that our lifestyle choices can be an important trigger to firing the gun. If you're carrying the genes for autoimmune disease, if you've got a family history of inflammatory bowel disease or thyroid problem or rheumatoid arthritis, you're carrying the genes, but what can be the trigger? Your lifestyle choices can be the trigger. So they can be in the form of food, what you put on your plate, and also in the form of food that's not on your plate, which is the secondary food, which could be, you've got immense stress in your life, or you had an infection. There have been some articles which quote infectious mononucleosis or infection with Proteus can trigger off rheumatoid arthritis, but more research needs to be done into that. So what happens if the gun is fired? We can't always prevent stress, we can't always prevent infection, even though if we're eating healthy. So the gun has fired, what can you do? Eat more plants, eat more plants is the key thing. Diverse variety of plants in your diet, more protein in the form of legumes and in the form of pulses. They're full of protein and fiber. So have that whole food plant-based diet. Add in omega-3 to the diet as well as vitamin D. That will control the damage going further on. So those are the key things I want you to take away regarding nutrition: is whole food plant-based diet. Your genes are not your destiny. You can change that by eating a whole food plant-based diet, adding omega-3 fatty acids and vitamin D to your diet. So breaking news, animal products do not contain any fiber. I'm sure most of you knew that, but just to re-emphasize. So to say that, to summarize, the choice is ultimately yours. So you want to go for a whole food plant-based diet? Yes, please do. It will decrease the risk of your cardiovascular disease. It will decrease the chance of obesity. It will decrease the chance of hypertension. It will decrease the chance of type 2 diabetes. So the choice is entirely yours. Autoimmune conditions as well, as we've learned. So that was to summarize about the role of plants in autoimmune diseases and generally in leading a healthy full life with a decrease in the chance of chronic disease. So coming to exercise, what about exercise? I find that whenever I have a consultation with someone with rheumatoid arthritis or osteoarthritis as well, the limiting factor is pain. So it is natural to avoid exercising when you've got pain. You don't have to push yourself if you can barely walk in the morning. So, but what does exercise actually do? So the evidence or the benefits, of exercise are threefold. It improves your muscle strength and flexibility. So when your muscle strength is increased and you're more flexible, that decreases the stiffness in the joint, which has a knock-on effect on the pain. So naturally, pain is reduced as well. And the second is the weight-bearing exercises, which helps to keep the bones strong, which in turn decreases the risk of osteoporosis, the thinning of bones. And the third is balance exercises. They reduce the risk of falls. So less falls, less chance of fractures. So threefold benefits there of exercise, generally in general population and in rheumatoid arthritis in particular. Now let's look at this. This is like this circle of rheumatoid arthritis. We learned that rheumatoid arthritis is associated with increased risk of cardiovascular disease. Hence, lifestyle is very important. So exercise, we know from numerous studies, it's evidence-based, that it decreases the risk of cardiovascular disease. So, the 30 minutes of exercise per day or 150 minutes of aerobic exercise is what the NHS recommends that you do. So exercise also helps with management of weight, which we know further reduces the risk of cardiovascular diseases. And then that, again, muscle strengthening that we get because of exercise leads to more support and movement. The joints become supple. And, that has actually, I've seen in practice that increases the positive attitude towards exercise as well. So it is a circle. Once you start exercising, the feel-good chemicals, the feel-good hormone, serotonin, you feel like exercising more. I'm sure most of you must have experienced that. So going through what do the various professional organizations around the world recommend for rheumatoid arthritis patients. So when I was reading about this, and it was very interesting what the American and the British Society of Rheumatology say about exercise, which is not much. So American College of Rheumatology says there's no mention of physical activity, but physical therapy like hydrotherapy is recommended. And it's the same with the British Society of Rheumatology. It says aerobic exercise needs to be encouraged, but it has a caveat that minimize joint destruction. So it's like, cautioning people about that. But the best advice, I think, in my opinion, comes from the Royal Australian College of GPs, which says exercise should be individualized for the three important things we talked about: strength, endurance, and aerobic capacity. So wonderful. I think this is what we need in the British Society of Rheumatology guidelines as well. And the EULAR, the European League guidelines, also talk about non-pharmacological interventions as adjuncts. Again, they talk about occupational therapy, hydrotherapy, and dynamic exercise. But I think the key is individualized exercise. No two people are the same. Two people with rheumatoid arthritis are not the same either. So it should be an individualized exercise for strength, endurance, and aerobic capacity. Now let's meet our patient, Mrs. X. She's 35 years old. She feels like a 90-year-old, and she was diagnosed with rheumatoid arthritis at the age of 30 years. So as we were talking earlier about the NICE guidelines, painkillers, started on medication, hydroxychloroquine by the rheumatologist, progressive worsening of joint pains, asked to consider going on methotrexate. That's when, went to the doctor in the sky, Google, methotrexate, side effects, blood test. She panicked. So she came, discussed this with me, her general practitioner and lifestyle medicine physician, and incorporated whole food, plant-based diet and exercise in her daily routine. So no processed food or fizzy drinks, gave up smoking, and lost 5 kilos of weight. Any surprises in the result? 1 year on, she's medication-free, she's pain-free, and her inflammatory marker CRP is in the normal range. It hadn't been in the last 5 years. So I think this is not just one patient. There are many other patients, their case studies, on and on. So we need to be aware as health professionals about the role of plant-based diet and exercise. And as the general public, we need to be aware about talking about this to our rheumatologist, talking about this to a lifestyle medicine physician, talking about this to our general practitioners. And, this, I think, is the way forward. So the lifestyle first approach, as conventional doctors, we talk about, okay, you've got high blood pressure, here is your tablet. And then, by the way, you need to exercise and lose some weight as well. So what is different in lifestyle medicine is the lifestyle first approach. It is the key. I must say, though, it has to be individualized. No two people are the same, as I said. So what are the 6 pillars of lifestyle medicine? We have talked in detail and in some detail about exercise and a whole food plant-based diet now, but it also emphasizes about stress reduction, positive psychology, and stopping smoking, alcohol, and other drugs, and also about sleep management. So all 6 of these factors together caused rheumatoid arthritis remission, or the pain-free status of this lady here. So that is worth talking to your doctors about, to have an individual plan for your exercise and discussing about the evidence of whole food plant-based diet we learned today. So to summarize the talk, I'd say it's seek advice about individualized aerobic, strengthening and balance exercises, and lifestyle first approach can help in relieving the symptoms of rheumatoid arthritis like they did for this lady. This could be me, this could be you. And eat a rainbow of fruit and vegetables every day. Increase your fiber intake. Supplements to be used are omega-3 and vitamin D. Here are the links to all the references I've used in my talk today. And I would say thank you so much for listening to me, my audience. And thank you so much to Dr. Shireen and Dr. Layla for giving me this opportunity, and to Pete and Tom from WedgeFest UK. Thank you very much. I'm happy to take questions.
Thank you, Alpa. That was really interesting. One of the things I actually wrote it down was, even when the gun has fired, plants can do the damage control. I really love that. Thank you. I'm going to remember that. There's actually one question from a lady called Margaret. She has been eating a whole food plant-based diet, and she takes vitamin D every day. And she has stopped eating nightshades because she believes that they are a trigger, but she still experiences some pain in her legs and lower back. Any advice?
Right. So obviously, we give individual advice for patients depending on their individual circumstances. And talking about vitamin D, yes, we do recommend, especially if you're in the UK or in a country where there's not enough sun in the winter, that 10 micrograms should be taken from the months of October until March every day, which I suppose Margaret is doing already. But then depending, usually people have low levels if they are if they're dark skin like me, Asian background, you need to increase the dose then in that case, or if you're indoors mainly. So it might be that the dose that she's taking is not enough. So it might be worthwhile checking that with her general practitioner, because low vitamin D, as we know, is associated with body aches, general fatigue, which again is a symptom of rheumatoid arthritis, and low mood as well. So it might be worthwhile checking that. And interesting, you bring the point about nightshade. So if we go into the root cause of disease, into the gut microbiome, which I briefly touched on, they say that nightshades like eggplants and tomatoes can help with joint pain. But again, this is not like a blanket statement. It wouldn't work for everyone. I've had patients with rheumatoid arthritis who've stopped eating all nightshades but still had symptoms. But some people do find that it helps them. There are not many studies around it, but if she's given that up, I would say the next step would be exercise, to see into what she is really doing in terms of exercise. So seems like she's got vitamin D in her diet, and perhaps omega-3 as well, and whole food plant-based diet, like the plate we discussed from our plant-based health professionals, and plenty of water. And every person is different. The rate of disease progression in everyone is different. So it's best to see a lifestyle medicine physician and see what check your vitamin D levels and see if there's something missing in the diet. Or sometimes I find that people can get repetitive in what they're eating, not getting the whole spectrum or not getting the whole rainbow in their diet. So that might help as well. I hope that answers the question. Thank you.
Yeah, that is good. And I think, I would like to add, a lot of people say, they eat a whole food plant-based diet, and I'm sure it has been your experience as well. But when we really look at the plate, at what they eat every single day, yes, it is whole food plant-based, but, you could have, for example, avocados every day, one avocado. So it is, a lot of fat.
Yeah.
It is healthy, but then, there isn't enough balance. Or I don't know if it was, I think Karine mentioned that earlier, you're having hummus every day, but with chickpeas, you need variety. And it's also about having, as you mentioned, those 10 portions of fruits and vegetables. So I would say optimize your diet first. Have a look, have a really an honest look at your plate and see, what changes you can make actually to, make it even better. So, and yes, and as you showed, I like the Eat Well guide myself, the plant-based. I always use that. So have a look at it and, compare. So I think that would be...
I think print out a picture of a rainbow, put it on your fridge and tick box every day.
Exactly.
So
Yes.
just make sure you're getting the rainbow in your diet every day.
Yeah, I think initially that would help actually, because you need to change your habit, which is actually going to be the topic of our next talk. Changing habits is not easy. And until you get there, you need to have reminders, so, having a printout, I would agree, is a good thing to do. Now, somebody's asking, do you recommend any probiotics?
Well, probiotics, interesting field again. The gut microbiome is such an evolving field that we're learning new things about it every day. So studies done in the past have recommended the role of probiotics, especially, containing lactobacillus and bacteria, various kinds of bacteria there which help in the gut flora. But as we saw in the Eat Well guide, that we can do that with fermented, fermented food in our diet. That can be done. Or when you're eating a variety of food, again, the gut microbiome is healthy. So imagine, a group of children sitting together. I'm sure if you give them gummy bears, they'll all be happy. But imagine these are a group of grown-ups sitting in your tummy, and they are craving for different colors of food. So if you are giving them, your gut microbiome is healthy. But probiotics and prebiotics is an ever developing field, and functional medicine is more kind of geared towards that, into ensuring the gut health and root cause health. So they do recommend that you take probiotics every day, especially if you are suffering with autoimmune conditions or gut related conditions like inflammatory bowel disease.
Okay, thank you. Just one more question, actually, from myself. You mentioned that we shouldn't eat any animal products. Obviously, we all agree that it is a plant-based expo here. So, are there any other foods you would say which we should people with rheumatoid arthritis should avoid?
I think animal protein is the key that you should avoid because of the inflammatory effects. And generally we live in a day and age where kindness, last year has been an awakening about that. So kindness to animals, kindness to your own body. So animal protein. The second thing, which is coming again and again in various studies, is aspartame, the sweetener that we use. So there have been some studies which I wouldn't say they're robust enough, but patients find that can aggravate their pain. So there have been links between the neuronal pathways of pain and the artificial sweeteners. So if you are going on a whole food plant-based diet, and if you are trying to relieve the symptoms of arthritis, I would say that's one thing you should not have in your diet as well. And as Margaret mentioned, nightshade, that's again an evolving field into what you shouldn't be incorporating. Having said that, the huge evidence is for dairy. Deleting dairy from your diet, there have been many studies which show that improvement in joint health, improvement in overall fatigue, and in autoimmune diseases, general well-being, feeling better mentally as well. So that's another thing. And generally eating a whole food plant-based diet. So avoiding those three key things. I must also add gluten is another thing that is being studied again and again. There is some evidence. There are actually 3 big studies which have shown that eliminating gluten from the diet has helped in symptoms. But again, the conclusion comes with a warning that it is an individualized approach. So again, you can try that. That's a part of elimination diet that functional medicine doctors and functional medicine practitioners do for autoimmune disease. But that's something that you can look into and discuss with your doctors when you see your lifestyle medicine specialist, when you see your general practitioner or your rheumatologist. You can have a chat about whether it's sensible to do that. And maintaining a food diary like we do for what we're adding in our diet, you can also maintain one for what you're deleting and whether it's helping your symptoms.
Yes, that's lovely. Thank you. Yeah, I think we need to have an individual approach to nutrition. For example, I'm kind of sensitive to garlic. And it is such a good, actually, garlic is so healthy and everybody has it in the diet, but I know I'm sensitive. So I think we should always just, appreciate that there are individual kind of, sensitivity. So yes, and you can experiment, can't you?
Yes, absolutely. It's try and see what works for you. So no harm done there. As long as you're doing it sensibly in a sensible way, and if you need guidance for excluding things. So, and as I said, don't do it all in one go. That is why most diets fail, because you just completely change your lifestyle into what you're not used to, and at the end of the day, the cravings will come back on, and you will give in. So one small change at a time, and hopefully it will be in the right direction.
Yes, and also I think if you change everything overnight, you wouldn't know which one was it. Was it the gluten you should have avoided, or the nightshades, or So it is good actually to do it in steps. And like you said, it takes a while actually to get used to the new tastes. So just take your time. And the other thing I would like to add is that out there's a lot of kind of confusing messages. I get a lot of people saying, oh, but this doctor says I should avoid that. This doctor says this. So I think, just bear in mind, a lot of times, as I said, again, it is a repetition of what we just mentioned. We need to have an individual approach. So, and there are people like Dr. Kumar and, Plant-Based Health Online is there. So there is help out there, for somebody to have actually a look at what you eat, at your food diary, and guide you, what changes you should be making.
Absolutely. We're all here for you. Thank you.
Thank you. All right. So thank you very much, Dr. Kumar. Thank you, Alpa. I really enjoyed it. And I hope that the audience also enjoyed it. And have a good afternoon.
Thank you. You too. A pleasure and an honor. Thank you.
Thanks.